I got a lot of questions asking, what's a plasma infusion? How to get the plasma in your body? So today I thought I would share briefly and quickly a plasma infusion. These are my vials of medication. I also have a couple of these syringes and a mini spike to help me draw up that medication. This is the flow rate tubing. Depending on how long this is, that will determine the rate of the flow of the medication into a person's body. And here we have the needle set. This will attach to the flow rate tubing, and once it's unraveled, I will insert these tiny needles into my legs and tape them down. Now, some people prefer to do this in their stomach. I can't do that. I do it in my legs, and pardon my leg, but I just want to show you where I'm numbing. I've had this on for about an hour now. First, I remove, it's called Tachoderm. That's been keeping my numbing cream safe and sound, and clean the area with an alcohol wipe. And then I just take my needle and pinch my skin up just a tiny bit, pop the needle in. Believe me when I say it doesn't hurt, because I've had that numbing cream on there for about an hour. And then I just tape it down and do the same with the other. Okay, I've got all 4 of my needle sites plugged in and taped down, and all I have to do next is turn on the pump. There it goes. All right, see you in an hour. Okay, my infusion is done. I just take off the tape, pop that back out gently, close those little hummingbird wings, and wrap it with tape. Then I'm gonna deposit these needles into a sharps container. This is something that I do once a week for life. I don't know if you can tell, but it leaves these fairly large welts on my legs that are pretty uncomfortable, but overall it keeps me healthy. So I am very thankful.